The path of medicine. The earliest forms of medicine date back to ancient civilizations like the Egyptians, Greeks, and Chinese. They believed in the concept of balance, both in the body and in the environment, and used a combination of herbal remedies, magic, and religious rituals to treat illness. Some of their remedies, such as the use of willow bark for pain relief, still form the basis of modern medicine. In ancient Greece, the famous physician Hippocrates laid the foundation for scientific medicine with his famous Hippocratic corpus, which emphasized the importance of observing and examining patients, rather than relying solely on superstition and magic. The next step in the evolution of medicine came with the development of the scientific method in the 16th and 17th centuries. This period saw the rise of anatomists, who dissected the human body to better understand its structure, and led to important discoveries about the circulatory and nervous systems. However, it was not until the 19th century that medicine truly began to embrace science, with the discovery of bacteria and viruses and the development of techniques for diagnosing and treating diseases. The Age of Enlightenment, also known as the Age of Reason, was a cultural and intellectual movement in the 17th and 18th centuries that saw a shift from superstition and tradition to reason and science. This period saw the development of new medical theories and treatments, and the foundation of modern medicine. One of the key figures of this time was William Harvey, who discovered the circulation of blood and revolutionized our understanding of the human body. Another important figure of the Enlightenment was Edward Jenner, who developed the smallpox vaccine and paved the way for the modern field of immunology. The 19th century saw a continuation of this trend, with the discovery of anesthesia and the development of surgical techniques that allowed doctors to perform complex procedures with greater safety and success. The introduction of antiseptics and aseptic techniques by Joseph Lister further improved patient outcomes and reduced the risk of infection. In addition to these developments, the 19th century also saw the rise of the germ theory of disease, which held that illness was caused by tiny organisms, such as bacteria and viruses, rather than imbalances in the body or the environment. This theory revolutionized the field of medicine and led to the development of new treatments and technologies, including antibiotics and vaccines. So far, we have seen the evolution of medicine from the earliest forms of herbal remedies to the scientific and technological advancements of the Enlightenment. The 20th century, advances and challenges. The 20th century saw some of the most significant advancements in the history of medicine, including the discovery of insulin for the treatment of diabetes, the development of antibiotics for the treatment of bacterial infections, and the introduction of new surgical techniques and technologies. However, this period was also marked by significant challenges, including pandemics, such as the Spanish flu and HIV, AIDS, and new ethical and moral dilemmas, such as the use of human subjects in medical research. One of the key advancements of the 20th century was the discovery of X-rays, which allowed doctors to see inside the body without invasive procedures, and the development of radiology as a discipline. Another important development was the advent of cancer treatment, with the discovery of radiation therapy and the development of chemotherapy. The 20th century also saw the introduction of new technologies, such as the MRI and CT scans, which allowed for even greater insight into the human body. These advancements, along with new surgical techniques and the development of minimally invasive procedures, have transformed the field of medicine and improved patient outcomes. Despite these advancements, the 20th century also presented new challenges, including the rise of new and more virulent diseases, such as HIV, AIDS, and the emergence of antibiotic-resistant bacteria. The development of new technologies and treatments also raised new ethical and moral dilemmas, such as the use of human subjects in medical research, the use of embryonic stem cells, and the question of access to healthcare for all. We have now reached the end of our journey through the 20th century. Next we will explore the current state of medicine and its future direction. the 21st century has brought with it many new advancements and challenges in the field of medicine. One of the most significant developments has been the rapid advancement of technology and its application in medicine, including the rise of telemedicine and the use of AI and machine learning in medical diagnosis and treatment. Another major development of the 21st century has been the increasing focus on personalized medicine, with the use of genomic information to tailor treatments to individual patients. This has led to new and more effective treatments for a variety of diseases, and has also raised new ethical and moral dilemmas, such as the question of access to genetic information and the potential misuse of this information. Despite these advancements, the 21st century has also seen the rise of new global health threats, such as the COVID-19 pandemic, which has underscored the need for a coordinated and effective global response to public health emergencies. At the same time, the ongoing pandemic has also highlighted existing disparities in access to healthcare and the need for more equitable healthcare systems. Looking to the future, it is clear that medicine will continue to evolve and face new challenges, but with the continued development of new technologies and treatments, and the commitment to improving access to healthcare for all, it is an exciting time for the field of medicine. The field of medicine is constantly evolving, and it is essential for healthcare professionals to continue their education and stay up to date with the latest developments and advancements. This not only helps ensure the best possible care for patients, but also helps healthcare professionals stay at the forefront of their field and maintain their professional licenses and certifications. We hope you have enjoyed this video on the history of medicine, and we encourage you to continue your own education and growth as a healthcare professional. Thank you for watching Black Screen Science.